Have you ever felt this way? You hear about a virus in the news, then it disappears, yet doctors still quietly watch it. One of my patients once shared this with me. She asked, "If it is so rare, why do experts keep talking about Nipah virus?" I want you to imagine this: a lighthouse standing far from shore, not because a storm is happening today, but because it is ready before one ever arrives. I am Dr. Evelyn Carter, and for many years I have cared for older adults across the United States. I have learned that the questions people ask often matter more than the headlines they read. When patients ask why Nipah virus is still called a global health threat, they are not asking out of fear. They are asking for context. They want to understand what careful monitoring really means. When health professionals say a virus is still a global concern, it does not mean an outbreak is spreading or danger is close. It means systems are in place to watch quietly, study patterns, and stay prepared. Global health works best when it is calm and observant, not reactive. Nipah virus remains on watch lists because experts have learned that preparation protects people long before panic ever would. Older adults are especially sensitive to health news because experience has taught them that clarity matters. Unexplained warnings can create worry, while thoughtful explanations bring reassurance. That is why conversations like this are important. They help separate awareness from alarm. They help people understand why monitoring exists and how it serves public safety. At Senior Health Daily, my goal is to offer you steady guidance, not noise. If this kind of calm explanation feels helpful, please take a moment to like this video, share it with someone you trust, and subscribe to Senior Health Daily. Your support allows us to continue creating thoughtful, reliable health conversations made especially for you. In the next part, we will look more closely at what makes Nipah virus different from other infections and why global health systems continue to observe it carefully, with patience and perspective rather than fear. What makes Nipah virus different? When people hear the name Nipah virus, one of the first questions they often ask me is why this virus receives so much quiet attention from health experts even though most people will never encounter it. The answer lies not in how common it is, but in how it behaves. In medicine, rarity does not always equal insignificance. Some conditions are watched closely precisely because of what they are capable of under the right circumstances. Nipah virus belongs to a group of viruses that can move between animals and humans. This ability alone places it in a category that public health systems take seriously. Over the years, doctors and researchers have learned that viruses crossing from animals into humans can behave unpredictably. They may change, adapt, or appear in new settings. This does not mean danger is imminent. It means observation is wise. Another important difference is how Nipah virus affects the body. It has the potential to involve the brain and nervous system, which are areas doctors always approach with extra caution. The brain controls memory, movement, breathing, and awareness. When any virus shows the ability to affect these systems, it earns a place on watch lists, not because of fear, but because of responsibility. I remember speaking with a colleague years ago who explained it this way. Some viruses teach us lessons early, so we learn to stay prepared rather than surprised. Nipah virus is one of those teachers. Its history has shown that early recognition and careful monitoring make a real difference in outcomes. From a simple scientific perspective, this virus also stands out because it does not spread casually like a common cold. Transmission requires specific conditions. That is reassuring. At the same time, when those conditions exist, health systems want to be ready. Preparation is not panic, it is planning. For older adults, understanding this distinction is especially important. Many seniors have lived through periods when health information was shared with urgency but little explanation. That can leave lasting worry. Today, the approach is different. Experts monitor quietly, share data responsibly, and step in early when needed. What makes Nipah virus different is not constant danger. It is potential combined with responsibility. Public health systems watch it because experience has taught them that calm vigilance protects communities better than reaction ever could. This steady attention allows the rest of us to live our lives without fear, trusting that someone is paying attention even when we are not. Why rare does not mean irrelevant. One of the most common misunderstandings I hear from patients is this simple thought: if something is rare, then it must not matter very much. That belief is understandable, but in public health, rarity and importance are not opposites. In fact, some of the conditions watched most carefully are the ones that appear infrequently. Public health works on prevention rather than reaction. The goal is not to wait until many people are affected. The goal is to notice patterns early and reduce risk before it grows. This way of thinking developed over decades of experience. Health experts learned that by the time a problem feels obvious to the public, it is often already harder to manage. Quiet attention early can prevent loud emergencies later. I often explain this to older adults by using familiar examples. Conditions like certain aneurysms, rare infections, or even uncommon medication reactions are not everyday events, yet doctors stay alert to them. Not because they expect them to happen, but because when they do, early recognition can save lives. Nipah virus fits into the same category. It is rare, but it carries features that require respect and awareness. From a scientific standpoint, viruses that cross from animals to humans deserve extra observation. History has shown that many major health challenges began this way. Most never spread widely, but a few did. Public health systems learned from those experiences. Monitoring does not mean predicting disaster. It means learning continuously and staying prepared. For seniors, this perspective can be especially reassuring. Many older adults have lived long enough to see how fear spreads faster than facts. When experts monitor something quietly, it often goes unnoticed, and that is actually a success. It means systems are working in the background, protecting communities without disrupting daily life. I remember a patient once saying, "If it is rare, why talk about it at all?" My answer was gentle, because understanding how prevention works builds trust. When people know that health experts are watching potential risks calmly and responsibly, they feel less anxious when those topics appear in the news. Rare does not mean irrelevant. It means selective attention. It means thoughtful observation based on evidence, not alarm. For Nipah virus, the approach reflects lessons learned from the past. Staying informed without panic allows both individuals and systems to respond wisely. That balance between awareness and calm is one of the strongest tools public health has, and it is something worth understanding. Global travel and changing environments. When we talk about why health experts remain attentive, global travel and environmental change often come up quietly in the background. These are not new ideas, but their impact has grown over time. The world today is more connected than it has ever been. People, animals, and goods move across borders quickly and routinely. Most of the time, this connection brings opportunity and enrichment. From a health perspective, it also means that distance no longer provides the protection it once did. I often explain this to patients by reflecting on how different travel looked decades ago. Long journeys were rare and slow. Today, someone can cross continents in a single day. This does not mean illness is spreading everywhere. It means that health systems must think differently. They must consider how movement changes patterns of exposure, even for rare conditions. Environmental changes also play a role. Shifts in climate, land use, and wildlife habitats can alter how humans and animals interact. When natural boundaries change, viruses that once stayed contained can find new pathways. This does not guarantee spread. It simply creates conditions that experts pay attention to. Awareness allows researchers and public health teams to study these changes early and respond thoughtfully. I remember a conversation with a public health colleague who described their work as listening rather than reacting. They watch how travel patterns shift. They study how environments evolve. Most of the time, nothing happens. When something does change, early awareness helps guide calm decisions rather than rushed ones. For older adults, this context is important. News headlines often connect global travel or environmental change with fear. What is rarely explained is that monitoring exists precisely to prevent disruption. Health experts do not wait for crises. They study possibilities so that communities remain protected without alarm. From a scientific perspective, preparedness is a quiet process. It involves data sharing, cooperation across countries, and careful observation. None of this requires public anxiety. In fact, anxiety can make understanding harder. Calm explanation allows people to trust the process. Why do experts remain cautious? Because experience has taught them that the world is dynamic. Movement and environment influence health in subtle ways. Staying attentive is a sign of responsibility, not danger. When seniors understand this, something important shifts. They stop seeing monitoring as a warning and start seeing it as care. It becomes easier to follow health information with curiosity rather than worry. That sense of perspective is exactly what allows people to stay informed while still feeling secure in their daily lives. Public health systems and early warning. When people hear the phrase public health system, they often imagine something distant or abstract. In reality, these systems are made up of ordinary professionals doing steady, careful work behind the scenes. Their purpose is simple: to notice small changes early so communities are protected quietly and effectively. Early warning does not begin with alarms. It begins with observation. Doctors, laboratories, and health departments share information about unusual patterns. A cluster of symptoms here, a change in animal health there. None of these signals alone mean danger. Together, they help experts decide whether closer attention is needed. This process is slow by design. Slowness allows accuracy. I have spoken with colleagues who work in surveillance, and they often describe their role as listening for whispers rather than waiting for shouts. Most days, the data tells them that nothing is changing. That is good news. On rare occasions, subtle shifts appear. Early awareness gives time to ask careful questions, verify information, and respond proportionately. From a simple scientific view, early monitoring reduces uncertainty. When health teams understand what they are seeing, they can guide hospitals, clinicians, and communities calmly. This prevents overreaction and also prevents delay. It is a balance that takes experience and coordination across regions and countries. For viruses like Nipah, early warning focuses on known points of risk. This includes animal health, environmental changes, and unusual human illness patterns. Monitoring does not mean expecting the worst. It means respecting what has been learned from history. When signals are detected early, responses can remain measured and targeted. Older adults benefit from understanding this process because it explains why some topics appear in health discussions without causing immediate concern. When seniors hear that experts are watching something, it often means the system is working as intended. Quiet preparation protects daily life from disruption. I recall explaining this to a patient who felt uneasy whenever she heard about monitoring. She thought it meant danger was approaching. When she understood that early warning exists to keep danger distant, her perspective changed. Monitoring became reassuring rather than unsettling. The role of early warning is not to frighten the public. It is to give professionals time and clarity. When systems function well, most people never notice them. That invisibility is a sign of success. Public health systems do their best work when they remain calm, coordinated, and patient. Early warning allows decisions to be thoughtful rather than rushed. It is one of the quiet reasons many potential problems never become real ones. Understanding this helps people trust the process and feel steadier when health topics arise. Why older adults should understand the context. Older adults often receive health news differently than younger people. This is not because they are less informed, but because they have lived long enough to remember moments when medical information was shared without explanation or reassurance. Many seniors grew up in times when a diagnosis sounded final and a warning felt urgent. Those memories shape how new information is felt in the body. not just understood in the mind. When older adults hear that a virus is still being monitored, the word still can quietly trigger concern. It can sound like something unresolved or threatening. Without context, the nervous system fills in the gaps. Anxiety rises not because of the facts, but because the meaning feels unclear. This is why explanation matters so deeply for this age group. Understanding context changes everything. When seniors learn that monitoring is a routine part of responsible healthcare, fear often softens. They begin to see that public health is not reacting to danger, but maintaining awareness. Context turns vague concern into grounded understanding. It replaces imagination with information. I have seen this shift many times in my practice. A patient comes in worried after watching the news. She says she feels unsettled, but cannot explain why. When we talk through what monitoring actually means, her shoulders relax. She realizes that nothing has changed in her daily risk. What has changed is her understanding. That understanding brings calm. From a simple scientific standpoint, the human brain seeks certainty. When information feels incomplete, the brain tends to assume the worst. Older adults may be especially sensitive to this because health has already required more attention with age. Clear explanations help the brain settle by answering the question behind the worry. Am I safe right now? Context also helps seniors decide how much attention to give a story. Not every headline deserves the same emotional energy. When people understand the difference between awareness and alarm, they can choose to stay informed without feeling overwhelmed. This choice protects emotional well-being. Family members and caregivers play an important role here. Sharing information calmly, without urgency, supports understanding. Asking what concerns came up rather than dismissing them creates trust. When older adults feel respected in these conversations, they are more open to reassurance. Understanding context does not mean ignoring health information. It means placing it where it belongs. For seniors, this skill is empowering. It allows them to remain engaged with the world while protecting their peace of mind. When older adults understand why certain topics are discussed and how monitoring works, anxiety loses its grip. Knowledge becomes a source of stability rather than stress. That is the true value of context. At this point in our conversation, I want to pause with you for a moment. Not to add urgency and not to change the tone, but to acknowledge something important. Understanding health, especially topics that appear in global discussions, can feel heavy. It takes time and attention to listen calmly and stay present. If you are still here, that tells me you value clarity over noise. Over the years, I have learned that people often find this channel during quiet moments. Sometimes it is late in the evening, when the news feels overwhelming. Sometimes it is early in the morning, when questions linger before the day begins. These are moments when people are not looking for headlines. They are looking for perspective. They want someone to explain what matters and what does not without pressure. That is why Senior Health Daily exists. This space is meant to slow things down. It is meant to help older adults feel informed without feeling alarmed. When understanding replaces confusion, the body relaxes. When fear eases, the mind becomes clearer. This is not just emotional comfort. It is part of how the nervous system stays balanced. I also want to recognize the caregivers and family members who may be listening alongside you. You are often the ones searching for information, hoping to support someone you love while managing your own concerns. Clear guidance helps you feel steadier too, so I want to share this with you in a gentle and sincere way. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. This invitation is not about numbers. It is about building a community that values thoughtful health conversations. When you subscribe or share, you help ensure that these discussions reach others who may need reassurance rather than urgency. What matters most to me is that you feel respected and supported. Health information should not feel rushed or frightening. It should feel like a steady hand and a clear voice. As we continue, I invite you to stay connected in whatever way feels right for you. Understanding grows best in calm spaces, and that is what we will continue to offer here. Pandemic potential explained calmly. The phrase pandemic potential can sound heavy, especially to those who remember recent global events. When people hear that term, many assume it means a prediction or a warning that something is about to happen. In public health, that is not what potential means. Potential is not a forecast. It is a category used to guide preparation, not to announce danger. I often explain this by comparing it to weather awareness. Knowing that certain conditions could produce a storm does not mean a storm is coming tomorrow. It means experts understand what to watch for and how to respond if conditions change. Most days, nothing happens. Preparation exists so that if change does occur, response can be calm and measured rather than rushed. In medicine, potential refers to characteristics, how a virus behaves in certain environments, how it interacts with the human body, whether it has shown the ability to change or adapt in the past. These observations are collected slowly and carefully. They are not guesses, they are patterns studied over time. For Nipah virus, the word potential reflects responsibility. Health experts have seen that it can affect serious systems in the body and that it originates in ways that require thoughtful monitoring. This does not mean it is spreading widely or that everyday life is at risk. It means professionals choose to stay attentive rather than complacent. I have found that older adults feel much steadier once this distinction is clear. Many tell me that the word potential sounded frightening until they understood its purpose. Once they realized it was about preparedness and not prediction, their worry eased. Language matters. When words are explained calmly, they lose their power to unsettle. Sensational language often skips this explanation. Headlines may shorten complex ideas into urgent-sounding phrases. That can leave viewers feeling tense without understanding why. My role as a physician is to slow that moment down and return meaning to the words being used. From a simple scientific standpoint, most viruses with potential never become widespread threats. Monitoring exists to keep it that way. The goal is prevention through awareness, not fear through speculation. When preparation works, it often goes unnoticed, and that is a success. For seniors especially, calm explanation protects emotional well-being. It allows people to stay informed without carrying unnecessary stress. Understanding that potential is a tool for planning helps restore balance. It reminds us that vigilance and fear are not the same thing. When we remove urgency from the language and replace it with context, the conversation becomes manageable. Pandemic potential then becomes what it truly is: a reason for steady attention, thoughtful preparation, and confidence in systems designed to protect quietly rather than alarm loudly. Why health experts keep monitoring Nipah virus. Health experts continue to monitor Nipah virus for reasons that are practical and grounded in experience, not because they expect an emergency. Monitoring is a professional habit built from lessons learned over many decades. When doctors and public health teams decide to keep an eye on something, it usually means it has shown characteristics that deserve respect and consistency. One reason is predictability. Some viruses behave in familiar ways. Others are less predictable. Nipah virus belongs to a group that can affect critical systems in the body and originate from animal to human contact. These features alone are enough to justify steady observation. Monitoring allows experts to understand patterns over time, even when nothing appears to be changing. That long view is essential in medicine. Another reason is memory. Public health carries institutional memory of past moments when early signs were dismissed. In several well-known cases, viruses that were initially considered unlikely to spread were not closely observed. When circumstances shifted, response became harder and more disruptive. Those experiences shaped today's approach. Monitoring is how experts avoid repeating earlier mistakes. I often explain this to patients by comparing it to routine screenings. A test is done not because something is wrong, but because it helps confirm that things remain stable. When results are normal, life continues quietly. When changes appear, action can be thoughtful rather than rushed. Monitoring Nipah virus serves a similar purpose on a global scale. From a scientific perspective, continued observation also improves understanding. Data collected over time helps researchers refine guidance, improve diagnostic tools, and strengthen coordination between countries. This work is slow and methodical. It does not create headlines, but it builds reliability. Older adults sometimes worry that monitoring means danger is increasing. In reality, it often means the opposite. It means experts feel confident enough to observe carefully without alarm. They trust the systems in place to notice change early and respond proportionately. I have seen how this explanation brings relief. Patients who once felt uneasy about ongoing attention begin to see it as reassurance. Someone is watching, someone is prepared. Most of the time, nothing needs to happen at all. Comparing Nipah virus to viruses that were once overlooked highlights why this approach matters. When attention is consistent, uncertainty stays manageable. When attention is absent, uncertainty grows. Monitoring is not a sign of fear. It is a sign of maturity in public health. It reflects a commitment to learning, remembering, and protecting without disruption. Understanding this helps people trust the process and feel steadier when certain names continue to appear in health discussions. Media headlines versus medical reality. One of the most challenging parts of staying informed today is separating headlines from medical reality. News is designed to capture attention quickly. Medicine is designed to move carefully. These two goals are very different, and when they collide, confusion can arise, especially for older adults who value clarity and context. Headlines often simplify complex topics into a few striking words. This can make an issue feel immediate or urgent, even when the underlying medical assessment is measured and calm. In healthcare, information is evaluated over time. Doctors look at patterns, data, and probability. A single report rarely changes medical guidance on its own. That difference in pace explains why news can feel alarming while doctors remain steady. I have had many patients tell me they felt uneasy after watching a report, even though nothing had changed in their personal health. When we talked it through, they realized the story focused on possibility rather than likelihood. Medicine cares deeply about likelihood, how often something happens, under what conditions, to whom. These questions matter more than dramatic framing. Medical reality is shaped by evidence. It considers who is actually at risk, how exposure occurs, and what protective systems are in place. Headlines may mention a virus name repeatedly without explaining that monitoring exists precisely to prevent spread. When that context is missing, fear can fill the space. Older adults can protect their peace of mind by changing how they receive information. Instead of asking, "Is this scary?" "Is this relevant to me right now?" Look for explanations that include numbers, trends, and professional guidance. Notice whether a story explains what has changed or simply repeats a concern. It also helps to limit repetition. Watching the same story across multiple channels can make it feel larger than it is. Choosing one trusted source and checking in briefly is often enough. More exposure does not always mean better understanding. Family conversations matter here as well. When seniors talk through what they have heard with someone they trust, anxiety often softens. Questions become clearer. Assumptions can be corrected gently. This shared processing is healthy and grounding. I want to emphasize that staying informed does not require staying tense. Medical reality rarely demands constant vigilance from individuals. That responsibility belongs to systems and professionals trained for it. Your role is to stay curious, ask thoughtful questions, and return to daily life with confidence. When older adults understand the difference between headlines and medical assessment, they gain control over their emotional response. Information becomes something to consider, not something to carry. That distinction protects mental well-being and allows knowledge to serve its true purpose: to inform calmly, guide wisely, and support steady living in an often noisy world. Staying informed without fear. As we bring this part of the conversation to a close, I want to leave you with something practical and reassuring. Staying informed does not mean staying anxious. In fact, the healthiest relationship with medical information is one that supports calm decision-making rather than constant concern. Smart awareness begins with intention. Ask yourself why you are seeking information. Is it to understand context, or is it to quiet a worry that keeps returning? When the purpose is clear, it becomes easier to choose how much information is enough. Most health topics do not require daily checking. A brief, thoughtful update from time to time is usually sufficient. Choosing reliable sources makes a meaningful difference. Trust information that explains rather than warns. Look for guidance that includes context, probabilities, and professional consensus. Sources connected to public health institutions, major medical organizations, or experienced clinicians tend to focus on accuracy over attention. If a headline creates urgency without explanation, it is often incomplete. I encourage older adults to notice how their bodies respond to information. If reading or watching health news leaves you tense, unsettled, or restless, that is a signal to step back. The nervous system absorbs emotional tone as much as facts. Calm explanations support clarity. Alarmist language does not. Another helpful practice is setting boundaries. Decide when and how often you will check health news. Avoid repeated exposure to the same story across different platforms. Repetition can magnify worry without adding understanding. One clear explanation is often more valuable than many fragmented updates. Conversations also matter. Talking through information with a trusted family member or caregiver can restore perspective. Questions sound different out loud. Assumptions soften when shared. This kind of dialogue helps transform information into understanding rather than stress. From a medical perspective, it is important to remember that responsibility for monitoring risks does not rest on individuals. Public health systems exist to watch trends, analyze data, and respond when needed. Your role is not to anticipate danger. Your role is to live well, stay engaged, and seek guidance when something directly affects you. Staying informed without fear is a skill, and like any skill, it improves with practice. It requires patience with yourself and trust in the systems designed to protect quietly. When information is received thoughtfully, it becomes empowering rather than overwhelming. I want older adults to feel confident in their ability to navigate health topics without losing peace of mind. Knowledge should support steady living. When chosen carefully, information becomes a companion, not a burden. That balance allows you to remain connected to the world while still honoring your own sense of safety and calm. As we come to the end of this conversation, I want to thank you for staying with me until the very last moment. Listening with care is not a small thing. It reflects a quiet strength and a willingness to understand rather than react. Throughout this video, we have talked about Nipah virus not as an immediate danger, but as a topic that remains under watch because responsibility in medicine means paying attention early and calmly. Monitoring exists so that daily life can remain steady and undisturbed. It is not a signal that something bad is about to happen. It is a sign that systems are doing their job thoughtfully and patiently. For older adults, understanding this difference matters deeply. When information is placed in the right context, fear loosens its hold. You begin to feel more grounded, more in control, and more at ease with the world around you. Knowledge, when shared with care, becomes a source of calm rather than stress. I also want to acknowledge the body itself. The body has carried you through decades of change, challenge, and adaptation. It responds best when it is trusted and respected, not rushed or pressured. Gratitude for the body is not about ignoring concerns. It is about recognizing resilience and honoring the pace of life as it unfolds. Senior Health Daily was created for moments exactly like this. A place to return when health news feels too loud. A place where explanations are gentle and trust is built over time. You are always welcome here. If this conversation brought you clarity or reassurance, I invite you to stay connected with us. Continue walking this path with Senior Health Daily. Together, we will keep choosing patience over panic, understanding over noise, and confidence rooted in calm.